In this video, we will explore the impulse conduction system, which helps to facilitate sequential electrical excitation of the heart and subsequent contraction. Electrical excitation through the heart propagates through specialized cells organized into specialized conduction tissues called the impulse conduction system. The propagation of electrical excitation through the impulse conduction system helps to coordinate sequential electrical excitation and subsequent contraction of the heart to ensure, for example, the atria contract before the ventricles and that contraction of each chamber is optimized to maximize cardiac output. The path of propagation begins in the sinoatrial node, anterolaterally around the junction of the superior vena cava and right atrium. The sinoatrial node is the origin of automaticity because of the ability to spontaneously generate action potentials. The excitation which originates in the sinoatrial node propagates across the walls of the atria. This is possible because all cardiac myocytes are connected in an electrical syncytium via gap junctions. Atrial depolarization corresponds to the P wave on an ECG and normally lasts 80 milliseconds. Once the right atrium has been electrically excited, the wave of electrical excitation converges on the atrioventricular node, also known as the AV node. The AV node is located around where the coronary sinus empties into the right atrium. The AV node serves as an important site of conduction delay, typically around 120 milliseconds. This allows the atria to contract and empty about 20% of the end diastolic volume, equivalent to approximately 25 milliliters, into the ventricles before ventricular contraction. AV nodal conduction delay corresponds to the PR interval on an ECG and typically lasts between 120 and 200 milliseconds. Failure of the AV node to provide appropriate conduction delay can cause heart block. In its simplest form, heart block is a PR interval that exceeds 200 milliseconds, but severity can vary. First-degree heart block is a simple prolongation of the PR interval, whilst third-degree heart block is complete failure of propagation through the AV node. Distal to the AV node is the bundle of His, which lies posteriorly within the interventricular septum. This is the wall that separates the ventricles. This and the remaining parts of the impulse conduction system facilitate ventricular excitation, which corresponds to the QRS complex on the ECG and typically lasts about 120 milliseconds. Shortly after it has emerged from the AV node, the bundle of His bifurcates into left and right bundle branches. These again are embedded in the interventricular septum. The right bundle branch is thick and cable-like, while the left bundle branch is a broader sheet of fibres. The right bundle branch gives rise to two branches, one which continues towards the apex, and another, called the moderator band, which passes into the right ventricle. The left bundle branch gives rise to two fascicles, which travel to the anterior and posterior left ventricle and their papillary muscles. Excitation of the papillary muscles is important for securing the leaflets of the AV valves during ventricular systole and therefore preventing backflow of blood into the atria. Transmural myocardial infarctions that involve the left anterior descending coronary artery can cause ischemia and infarction of the anterior papillary muscle. This can mean that papillary muscle no longer secures the anterior cusps of the mitral valve during ventricular systole and can lead to regurgitation. This would produce a pansystolic murmur between the S1 and S2 heart sounds on cardiovascular examination. Both left and right bundle branches send fibres, called Purkinje fibres, throughout the ventricular free walls to propagate the final part of electrical excitation of the heart. This distribution of fibres ensures that when the ventricles contract, they do so from roughly the apex towards the base of the heart, ensuring effective propulsion of the end diastolic volumes towards the great vessels. In this video, we introduce the impulse conduction system and the path that it takes to ensure effective electrical excitation of the heart and subsequent contraction.